Hello, I'm Feliciea Jibson, Managing Director at Felser Limited. I will be speaking with Dr. Kwan Bruhl, clinical psychologist from Brussels, Belgium. How are you, Kwan?
Thank you, Felicia. I'm very well.
Kwan, tell me about yourself.
So I am Dr. Bruhl. I'm a clinical psychologist and I'm a psychotherapist trained in cognitive behavior therapy. I'm also specialized in diagnosing and taking care of people who are diagnosed with autism spectrum disorders, as well as learning difficulties, what is normally known as neurodiverse people. And based on 10 years of clinical experience, I have recently developed the Situated Behaviour Intervention Method. And this method is aimed at supporting different challenges.
The focus of your work?
The focus of my work is supporting parents, because I believe that parents are the center of all the children whom we professionals take care of. And I believe in empowering parents to be independent in how they support their children at home, even if the child also has a professional multidisciplinary team around them, whether it is in the clinical environment or it is in the home environment. The idea is that both parents and a clinical team work together and collaborate in order to take care of the difficulties of the child.
Why it is important to support parents of neurodiverse children?
As I was saying, I believe in empowering parents. Over the years of my clinical experience, I've realized that any kind of professional intervention that a child is given, the child's development and progress is a lot faster if parents play a central role in the intervention of the child. And therefore, giving parents a set of strategies that they can implement at home, in addition to all the services that the child would be having, makes the child's development and their progress a lot more faster, and it lasts within the long term. Also, parents provide a certain security for the child, and the parents can only do that if they are equipped, if they have knowledge, if they understand what exactly the child is being offered by professionals.
So what role does PAGS play in your work, Kwan?
I see PAGS as a powerful tool that enables coordination and a good tracking of the overall progress of the child. Mostly, children who are on the neurodiverse spectrum, more than half the time, have different professionals taking care of them. So for example, they can be seeing a child psychiatrist, or they'll be seeing a clinical psychologist, or speech therapist, or occupational therapist. And so when the child is surrounded by a lot of professionals from different disciplines, sometimes all the professionals, we can lose track of the overall and the global overview of how the child is developing. And therefore, I see PAGS as a central coordinator in helping all the professionals who are looking after the child or who are intervening in the progress of the child to be able to coordinate and for all of us to have a global overview in terms of how the child is progressing and when intervention plans must be modified. In that sense, PAGS plays a very central role in keeping us all on our toes in terms of understanding the different developmental steps and progress that the child makes.
Briefly tell us about your Autism Assessment Center, Dr. Kwan.
Recently, I've opened an Autism Assessment Center in Belgium, just outside Brussels. The purpose of this center is that we are able to provide not only assessment, but also intervention services focused on children who are on the autism spectrum. We provide multidisciplinary interventions for autism spectrum conditions so that people with autism and their families will feel understood and supported without any exceptions in their communities.
Well, thank you ever so much for the coming for this mini interview. And next time we'll be talking about the interventions and treatment for neurodiverse people provided by your center.
Thank you, Feliciea.